Hi everyone. I am waiting for my guest, Emily Hooker. We are going to be talking today about abnormal bleeding and acupuncture. So let me just wait for her. Okay. Emily, do you see a button to join me? I know you're on. She should be coming on momentarily. Hey, Emily.
Hi, how are you?
Hi, good. Thanks so much for joining in on this Friday morning. And hi, everyone. Welcome to another live from the TheFibroidDoc, where I help women with fibroids live a life free of bleeding, pain, and also to optimize their fertility. And so today we have a special guest, Emily Hooker, who is going to talk to us about acupuncture. So, Emily, I'll let you introduce yourself.
Hi, I'm Emily Hooker. It's nice to talk to you. Thanks for having me. So acupuncture is often used in the United States, it's primarily used for pain management and gynecological issues, and that's partially because that's where the research is here. But yeah, we use very small needles to address a range of issues and imbalances. Do you have specific questions about fibroids?
Yes. So I'll go through a few things that I want to talk about. So that's interesting. I knew a lot of people use acupuncture for pain, but I didn't know that GYN issues were actually like up there,
Yeah,
also.
fibroids, endometriosis, yes, dysmenorrhea is a big one.
Yeah, or painful periods. Yeah, that's great. And in Western medicine, there was at least maybe a decade ago, there was a lot of resistance towards, alternative treatments for pain management and medical conditions. And when I was going to medical school, it was like a really new thing to be doing, acupuncture or introducing it more into the mainstream part of care. But today, a lot of patients are first wanting to try these alternative methods before they really want to put any medications into their body or injections or undergo surgery, which I think is fantastic, trying to see what they can control by themselves first through some of these more non-invasive ways. And I was looking up the research on this, and specifically at acupuncture and fibroids, acupuncture and bleeding. And there was a study that looked at dysmenorrhea or painful periods, and they looked at using acupuncture to treat this condition and birth control pills. And they actually found that with the acupuncture, those who underwent acupuncture, they had a lesser use of pain medications during periods, and also improvement in quality of life. So, there's definitely been some randomized studies with acupuncture and bleeding. And also, when we specifically look at fibroids, there's been studies that look at how acupuncture can really regulate the nerves and the sex hormones that
Yeah,
contribute to
yeah.
um,
And
to pains. Do you want to
this
say
is
something
one of
about
the
that?
benefits of Chinese medicine. One of the basic principles of Chinese medicine is to deal with the symptom, in this case, the fibroid, but also the root cause. So what's actually happening in the body to make. And of course, we know that genetics are a huge component, but we also know that epigenetics make a difference. So we can help support the environment that allowed the fibroids to grow. So even if my clinic is integrative, so I often work with doctors to help people, if surgery is appropriate, then we will help support that. But we also can assist in terms of making sure that they don't need a surgery 2 years later, that we can resolve the issues that are causing the fibroids to grow in the first place. We use dietary recommendations too, and we use herbal therapy. We want to reduce if there's excess estrogen, which is often the case with fibroids, we help the liver metabolize estrogen more efficiently. We can help with digestive functions so that the estrogen is being excreted properly from the body.
Oh,
So,
cool. I didn't know you could do all of this.
yeah,
In addition, yeah.
We recommend supplements like maybe DIM or diindolylmethane is appropriate. And if it really depends on what the situation is. If somebody's coming in for fertility and they find that they have fibroids, then at that point, a surgical intervention is often the most appropriate thing, just because
Sure.
you don't want to waste time.
Sure. Yeah.
But if that's not the case, then we might work using herbal therapies to reduce if it's large enough, we'll reduce the fibroids so that if the person does need surgery, it can be a more conservative surgery.
Sure. Or minimally invasive. Yeah. Instead of having to open. Yeah. Oh, that's great. So you touched a little bit on herbs. And so I would love to hear a little bit more about kind of what the process is, when somebody thinks, oh, maybe I want to try acupuncture. Can you go over a couple of, first of all, some misconceptions maybe that people have of acupuncture that they're like, oh no, like I'm not going to try that. And then when they actually try it, they're like, oh, this is amazing.
One thing I would say is that people are afraid of needles, and
Yeah.
these needles are hair thin. They're tiny needles, and you'll feel it on insertion, but it's not painful the way that, a vaccine, or an injection may be painful. And once the needle's in, it's actually very relaxing. People will, usually rest for half an hour, often fall asleep. And there's also research that shows that it reduces cortisol. So people leave feeling more relaxed, less stressed, and I think another misconception is like, is this actually going to be an effective therapy? And it often is. Again, in the case of fibroids, acupuncture may not be enough. You may need to use herbal medicine. People often have to make dietary changes.
Sure.
And
okay, so it's kind
herbal
of
therapy herbal therapy requires a little bit more. It's a little bit like food in that these are formulas that are designed to help move the blood, reduce inflammation, particularly in the uterine area. And as such, they're taken at least twice a day. So it's different than just taking a pill in the morning. It's a little bit more commitment, but they tend to work quite well.
That's great. Yeah. And have you seen changes in your practice? Like, people coming in with fibroids or, bleeding and they've tried acupuncture herbs and
yeah. I actually had a patient just recently who was trying to use acupuncture and she was nearing 50. So it was a situation where it didn't make sense to have her estrogen was already starting to decline. Main thing that I find helps right away for people is that we can reduce the bleeding, the heavy bleeds, which is this is what often causes anemia, fatigue. This is what I think, short of a large fibroid that's pressing on the bladder or the bowel, this is what impacts the quality of life most significantly.
Yes.
So to reduce the pain, the painful periods, and to reduce the quantity of the bleed, that's something you can see within the very first or second cycle.
Oh, that's great. That's really good. Awesome. So practically, when a patient, they say, okay, fine, I'm going to do acupuncture, I'm going to check it out. They make an appointment, they come. Can you walk me through like what they can expect?
Yeah, so we do a full intake. We ask questions that seem completely irrelevant. We do tongue and pulse diagnosis, which is to say we look at the tongue to see, one of the things that we'll often see with fibroids is sublingual distension. Underneath the tongue there will be some, the purple veins will be a little bit distended. You might see darker spots in the tongue, and then we feel pulses. The person will lie down the table. They're usually lying down for half an hour with needles in, and we often use something, in particular for fibroids, we often use something called moxibustion, which is an herb that it looks like a cigar, and it is burned over the uterine area, not touching the body. So it's a warming therapy, and that tends to work quite well. And it particularly works well to slow the bleed. So if somebody comes in, often with fibroids, I'll ask the patient to schedule their visits. They're going to come before their bleed, or during their bleed, so that I can reduce it after, the first heavy day. So we'll use that, and they'll lie there with the heat lamp on them and relax and rest, and then they're done after half an hour.
Okay, so it's about half an hour. As you mentioned, the needles may, it's kind of a funny, I've had acupuncture myself, so it's a little funny when it goes in, but it's not really painful. It's not a sting or anything like that. And then you just kind of let it work. You lay there for half an hour, and then you
Usually it's
go.
about 10 to 12 needles.
Okay.
Often a couple are placed in the lower abdomen over the uterine area, and then some will be in the feet and ankles.
Okay.
Yeah, people are typically fully clothed. It's not uncomfortable after the initial insertion, and oftentimes the initial insertion is not even uncomfortable.
Right. Okay. So, yep, you don't have to take your clothes off. Just kind of show up in some comfortable clothes, get it done, and then, leave half an hour later. How often do you recommend that people get acupuncture for heavy bleeding?
It really depends on the circumstances. Often if they want to get pregnant and also they have fibroids, then typically weekly, because we really want to set the stage, create an environment of optimal hormonal function. So then it would be weekly. If this is a chronic issue that they've had for a while, sometimes it will be every other week. It really depends on the person's commitment, but either weekly or every other week typically.
Okay. And then what do you say for people who are trying to get pregnant after, they've had fibroid treatment? So, they've had surgery for fibroids, they've taken some medication to shrink fibroids, now they're trying to get pregnant. So I know if acupuncture is used for fertility, what is the role kind of in pre-preparation prior to actually even being pregnant? What do you suggest for
we
those
typically
folks?
Weekly, and in that instance, treatment will depend on whether people are trying to get pregnant naturally or using some sort of fertility support. If they're doing fertility support, then I just recommend acupuncture. If they're not doing any fertility support, we will use Chinese medicine therapies, herbal formulas that are designed to support each phase of the cycle. So in the follicular phase, in the first phase, starting with the bleed, you want herbs that are going to build the endometrial lining and create a nice, supportive, set the stage for fertility and for the embryo to implant. And in the luteal phase, you want something that's moving the blood a little bit more, reducing any dysmenorrhea. It's really more toward invigorating the blood. So not developing. And again, it's a little bit tricky because if somebody is pregnant, you're not going to use those herbs. So if somebody's actively trying to get pregnant, we don't use herbs during the luteal phase.
Okay.
Only during the follicular phase. Whereas if they're preparing to get pregnant in several months, then we will use appropriate formulas for each phase of the cycle. And sometimes there's another formula for the ovulatory phase if they're having trouble with their luteinizing hormone or ovulation.
Okay.
Other anemia. We don't want people to get pregnant when they're anemic. So if they're not already taking iron and getting their blood levels to the appropriate level, we'll add herbs that will support that.
Great. So there's a lot of work here to be done prior to even getting pregnant in terms of getting your body ready.
Early.
And yes.
So
that's that's right. Blossom of Style says, this is great information. Thank you. So thank you. And please let us know if you have any questions for anyone who's watching. We'll be happy to answer those. And then, does insurance cover acupuncture?
Most in the Bay Area, I will say, I'm not sure what the case is in the rest of the country, but in the Bay Area, most plans do cover acupuncture. Yeah.
Okay.
So 75% of my practice is insurance based.
Okay. Okay. Great.
Most plans cover for pain, including potentially pain from fibroids. Oftentimes people will have a little bit of low back soreness, and that kind of thing is covered by acupuncture.
Right, by insurance. Yeah, great. All right. That's awesome. I mean, I did acupuncture for all of my three pregnancies, and I wish I even did it, in preparation for them, before, but I mean, the benefits were wonderful and really helped me feel relaxed. And yeah, also takes care of all the aches and pains during pregnancy. Do you
Part
see, what was that?
and postpartum when you actually need it.
That's right. Postpartum. I mean, this is so, ignored by our society, but I mean, taking care of a baby and you're all these weird positions, nursing a baby and all of this stuff. And I mean, I think acupuncture is just great anytime, really. But I think especially during pregnancy, before, fertility, and I see the whole topic today is fibroids and bleeding. I mean, I see like so many patients every day, with this specific problem. And it's just, I think, not one of those modalities that's discussed often, but it has such a, potential to really help. Um,
Yeah,
so
I would say more often than not, people come to us not knowing they actually have fibroids. And so during the intake, we might learn that they have frequent urination, that their bleeds are too heavy or feel heavier than they used to be, or, pain during intercourse. And
mhm,
I will often ask them to check in with their OB and be evaluated just to see what exactly is happening. If the fibroid is larger, like, larger than 5 centimeters, then we want to work with the doctor to see what
sure,
the plan is.
what the right thing is. Yeah.
With, and some people do want to use birth control in the line. Still acupuncture can be helpful.
Of course, yeah. We have a question from Radhika. She says, "Is acupuncture safe after a myomectomy? If yes, after how long after the surgery can you start acupuncture?"
Acupuncture is great after a myomectomy. Again, we really want to set the stage so that there's not future growth. I would say a week after the surgery. In that case, we may not do local points. We may just use distal points in the feet and hands. And we might also use moxa then. But yeah, we really want to make sure, particularly if the person is younger, that there's not going to be a recurrence. So we want to make
Yes.
those estrogens be metabolized efficiently. We want to make dietary changes if that's necessary.
Yes, that's one of the biggest concerns of a lot of young patients who undergo myomectomies. It's like, okay, we want to get pregnant, but I don't want this to regrow. And so acupuncture may be a great treatment, during that time when
Yeah.
post-surgery and while you're, eventually trying to get pregnant, to keep everything at bay. And also, as you said, the most important, I still think, is the dietary, changes too, which is something that is very much in our control. So for those listening, if you didn't listen to my previous Instagram live on fibroids and food, I would definitely recommend that you take a listen to that as well. So can you just give us like one or two tips on what kind of dietary changes you ask patients to make?
If somebody comes to me for fertility, well, I mean, if fibroids in general, I would say reduction of red meat, particularly reduction of anything that is, has hormones associated. Adding cruciferous vegetables, always adding lots of dark leafy green vegetables, but in particular cruciferous vegetables. This is less necessary if they're going to take a DIM supplement, because the DIM supplement is essentially meeting that need, but still you want a lot of fiber to help excrete once it's metabolized liver, but excrete it through the bowel. We like warm cooked foods in Chinese medicine, so we're not going to
Hmm.
recommend salads.
Got it. Okay.
So yeah,
Yeah. So more like veggie soups or things
yes,
like that. Okay. So
yeah.
yeah, warm.
Red meat is the one that we want to avoid the most.
Okay. So cut out red meat. Yes. Okay.
Alcohol
Um,
is great either.
what was that?
The alcohol is also not great.
Oh,
That's
yes, yes.
to hear, but we don't love, the
Yeah.
wine.
Well, there's so much studies, so much research now coming out on alcohol and how we really need to minimize the
Yeah.
alcohol. Yeah. Breast cancer risk and just overall, it's just really not great. So maybe just stick to the social drinking,
Yeah.
everyone. Um,
No one wants to.
so yeah, exactly. The holidays are coming up, so sure, you can have
Yeah.
have a glass of wine at the party, but yeah, no more, 3 glasses a day kind of thing.
No.
So, well, this has been so helpful. I mean, I'm an OBGYN and I've done acupuncture, and I've learned so many cool things today. So, thank you so much for all of this great information. I know a couple of people just joined us. If anyone has questions, please ask us right now. And in the meantime, do you have any last minute things you want to say before we talk about where to find you? Do you have any other last minute things you want to say about acupuncture and bleeding, acupuncture and fibroids?
The other thing I would say is that one herb that is very easy to use that I often like for fibroid growth is chaste tree, or otherwise known as Vitex. That's something.
Okay.
It's not. It wouldn't. I would never recommend it on its own, but in conjunction with other therapies, it could be like such as acupuncture and herbal medicine. That could be really useful. But again,
Vitex.
Vitex or chaste tree, yeah. But
Okay.
lifestyle, exercise, reduction of red meat, increase in cruciferous vegetables and dark leafy greens.
Yeah.
That lifestyle
Wonderful.
factor.
Yes, yes. And what's good about this is these are things we can control. I mean, we can't exactly control sometimes whether we get fibroids because we have a family history and genetics and whatever, but there are these things that we can do in our power, which is, our lifestyle modification and yeah, as you mentioned, the stress reduction and healthier lifestyle exercise, all of that. Awesome. So, where can people find you if they say, hey, this sounds cool. I've got a fibroid or I've got bleeding. I want to try out acupuncture. Where do you practice and how can we find you?
I have two clinics, one in Berkeley and one in Oakland, and I can be found at emilyhookeracupuncture.com.
Awesome. emilyhookeracupuncture.com. And you said Berkeley and Oakland,
Yes.
right? Okay. And we actually have one other question. Chaste tree herb in the form of tea or medicine?
Usually capsules or tablets.
Capsules or tablets? Okay.
Blend, but I like it better on its own. So yeah, and with Chinese herbs, they can actually be taken as tea, powder, or capsules. I often recommend capsules just because they don't taste horrible and it's less of a hassle. More people are more compliant when they're using capsules.
Got it. And is this something that you just get in like a like GNC, like a vitamin store?
Chaste tree you could find easily at Whole Foods or any place like that. Chinese herbal formulas need to be prescribed by a practitioner. They're
Sure, sure. Okay.
individual. Um, they can certainly be modified, particularly if somebody has anemia or heavy bleeds, then you want to modify the formula. So that has to come from a practitioner.
Got it. Okay. All right. Awesome. Well, thank you everybody for
Yeah,
participating. Thank you, Emily, for your time this morning and all this valuable information.
yeah.
Really appreciate it.
Thank you.
And everyone, check her out if you want to try out acupuncture. Please follow me on Instagram at TheFibroidDoc as well as on YouTube at TheFibroidDoc for more valuable information on fibroids. Have a great Friday, everyone. Bye.
Bye.
Bye.